We are very lucky here in the Low Country to have preventive MRI screenings right here in our backyard at MRI Wellness. We're here today with Dr. Tavel. Thank you so much for being here.
Thanks for having me.
Great to have you here. Okay, for those who don't know what MRI Wellness is, can you share a little bit more about it?
Full body, proactive, preventive MRI screening for the entire body. You learn more in an hour about your health than you would otherwise the rest of your life from the healthcare system. No radiation, no contrast, very safe, very thorough.
Do you think that preventive MRI screenings are going to change the world of healthcare as we know it?
I think we really do. When we look at, for example, mammography, which was available in the 60s, it didn't become standard care until the 90s. It required the Accountable Care Act and it required state governments to move that forward for women. The reason being, the insurance companies wanted data, they wanted research, and it takes time. Same thing with some of the other tests, the screening tests we do today. This will get there. We're doing research now with whole body MRI. It's going to take time for insurance companies to embrace it, but in the meantime, folks are not waiting for the insurance companies, and often that process is cumbersome, delayed, and very expensive. So we've short-circuited all those issues with this whole body MRI screening technology.
Yeah, these results can really be life-changing for people.
Absolutely.
How exactly does this work?
Right. So when they come in, that's a good point. So we've had MRIs before, and when you go to the hospital, it's a high throughput hospital environment, the white walls, sometimes a little less attentive and very expensive. So what we've done here is it's more of a concierge approach, very high touch. As you can tell here, it's nothing hospital about this environment. They come in, folks will schedule one of several ways. They'll come in, they'll meet our staff, and we'll go to the MRI. It takes about an hour, breaks along the way. And then within about 5 days, they'll get a report of the findings. They're reviewed by the medical director. They're read by whole body MRI radiologists who do nothing but American trained, fellowship trained American radiologists, and they'll get that report. And then our advanced provider sits down with them and goes over those results. It's organ by organ to give them feedback. It's been very well received. Yeah.
Do you think that insurance could ever cover these types of scans?
I do. Right now, HSAs will cover it. FSA will cover it. We'll get there. It took mammography 30 years. It took colonoscopy 30 years.
Yeah.
So if in 25 to 30 years, if not sooner, it will be covered. There's such a movement from the general population that it will be covered ultimately, because what we're doing here is we're picking up issues much earlier. Say, for example, cancer. And we talk about cancers, and all the screening tests we have available in the United States today really only uncovers probably 15% of malignancies. 85% are not picked up until they're late. And most of these things we see, late-stage diagnosis can be problematic. With early diagnosis, through what we're doing here, the long-term outcomes are so much better. It's very exciting.
Can these preventive screenings replace annual visits or other screenings at other doctors?
That's the best question of the day. The answer to that's no. So we need to continue to do our screenings. We're not going to, with whole body MRI, we're not going to pick up colon polyps. There's no bowel prep. We're not going to pick up breast cancer at the very early stages because of the density of the breast in young women. So yes, you need to continue all your screenings. What this is an adjunct to the primary care and the concierge and the functional medicine doctor's care. This is something as an add-on for them to help with their patients. And we're finding that folks are doing the mammography and the whole body, or they're doing the colonoscopy and the whole body. It's just another layer of scrutiny for your health.
Yeah, well, thank you so much for sharing all of this very important information, guys. And it's so easy to schedule your screening with MRI Wellness. All you got to do is call that number on your screen or just visit that website.